Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa, and today I'm joined by Greg Farnum. Thank you for being here today.
Hello, Rosa. Thanks for having me.
Yeah. So, you are working in health IT with a PointClickCare company, right?
Yes,
Can
yes.
you tell us about your current role, but also your background and how you got to be in healthcare?
Yeah, sure. It's been a while. I had to count the years earlier, so uh, it's time flies. But I've been in healthcare, believe it or not, for the Health Information Exchange and in healthcare for the last 30 years. So I started my career in a hospital association. And then I went from there and I founded a health information exchange in Vermont called Vital, and I worked on that for a few years, and then that was all during the high time of high tech, and in 2009, I went to work for ONC and helped other states build out their HIEs, and then straight to Audacious Inquiry. Been there for 12 years, building out the federal strategic advisory business, and I have an amazing team around me that's has decades of on the ground experience and all kinds of health information systems and public health systems. And we have really, three main things that we do. We do full stack engineering. We have expertise in managed services and health IT policy and regulations and standards and artificial intelligence, of course.
Mhm.
Primarily, our customers, our largest customers, are ASTP, ONC,
What does
and
that mean?
uh, the uh, the Assistant Secretary of Technology and Policy is the old or the new ONC, and it's been renamed to ASTP and CDC. So both of them are big customers, and then we work with a number of other state and federal agencies as well as HIEs and public health. We're part of PointClickCare, who's a leading health tech company with a simple mission of helping providers deliver exceptional care across thousands of facilities. And anyway, I'm glad to be here to talk to you about what we're doing.
Right? I mean, you really laid it out there in chronological order and everything. I feel like we built a timeline off of that. But you said you started working for a or a hospital association.
Yeah.
Is that Did you know you wanted to go into healthcare, or when you got out of college, like how did you end up in it?
Yeah, I actually was in geographic information systems of all things.
Really?
Yeah, I spent the first part of my career coming out of college working on a national park service grant,
Oh, wow.
and kind of related to healthcare. It was straight out of school. My job was to drive around the state of Vermont with my fly rod in the back of a state issued Jeep, locating all the trailheads and things like that. So I call that kind of healthcare related.
Well, it kept you healthy trekking around, didn't it?
That's right. That's right.
Really cool. And I guess it plays into now, usually I spend a lot more time with people going over their background and their motivation and things like that.
Yeah.
But as I was reading your answer to the $1 billion question, I just can't wait to get into it,
Okay.
because it's something I really care about and it's a need that I've really seen play out. Both my dad and my mother-in-law work for the state of Tennessee.
Yeah.
And, I've heard about the state of the health departments there,
Mhm.
from a couple different angles, from an epidemiology standpoint and from an accounting standpoint,
Okay.
and I can see how they could use a lot more, streamlining and technology upgrades, and that is something that it seems like you are really excited about improving.
Yeah.
So, how about I'm just gonna ask you the $1 billion question now, if that's
Jump
okay.
right into it. Right.
Yeah.
Yeah. Yeah.
Um,
Well,
so, well, let me ask it fully, okay?
okay.
It's my ritual now. So, Greg, if you were given a grant for $1 billion to meet the needs that you see in healthcare, how would you like to see it used strategically to have the most sustainable impact?
Yeah. Yeah. It's a great question. Um, as we know, $1 billion feels like it should go a long ways, but in healthcare, it doesn't always go as far as you'd like it to go. Um, I'm a big proponent of uh, taking small steps and building incrementally. So, um, as I thought about this, I certainly, you're obviously, I'm going to say something about artificial intelligence in my answer and how we should use that. And it's true that I think there is a lot of promise there. Um, so I think what I would end up doing in all my years of experience tell me that sometimes the technology gets ahead of the financing of healthcare, especially building incentives around taking care of patients. So it works for everybody, and it's a financial model that can be evaluated and show that it's sustainable and that other communities could pick up. So in addition to, I'd start off by spending it on the standard things of improving the health technology, using modern standards like FHIR, enabling artificial intelligence tools to really focus on, predictive models that could help identify chronic disease and some of the more costly things in healthcare, that some of which are fairly low hanging fruit. The um, medical medication errors and things like that that we really just need to fix in general.
Well,
But
I have a great example of that. One of my mentors reached out today with an example of how AI was used to reduce some discrepancies in prescribing aspirin to women who were at risk in pregnancy of preeclampsia. And I mean, for childbearing age women, the most
Mhm,
likely cause of death is pregnancy related complications.
mhm,
And the disparity they were seeing was that African American mothers were not getting prescribed aspirin as much. And
mhm,
so they implemented like an AI indicator when they met certain metrics to trigger the alert that this person needed to be started on this aspirin. Super basic.
yeah,
But the compliance went from it like tripled for those who were African American, but also for their non-Black counterparts because a
mm,
lot of people were getting missed. And
yeah,
so I
mhm,
really love how technology can cut through our human error and our human bias when we program it to do so.
right, right. So it's an amazing set of tools, and if I had that $1 billion, I would get all of that set up, but I would do it in a community that represented the rest of the country, with
Mhm.
a medium-sized community, build out all of the tooling that's necessary, and then I'd wrap around an evaluation model so we could really prove that it has an ROI attached to it. And then we'd implement a number of these tools, and most importantly, build some financial incentives for the community providers, the social needs providers, et cetera, to come together, leverage the tooling, the results, the AI, predictive models, and take care of all those patients, and really try to implement some of the things you're talking about to go for that low hanging fruit and fix a few of those medication error and other types of administrative use cases that are somewhat relatively easy to fix. But it's really kind of refocusing folks on working together and doing it in a way where the focus is on prevention and keeping people out of the hospital and keeping people well instead of like the other way around, bringing them in for care. And I think
Mhm.
if you could do that and you could model that and evaluate it properly, you know, reserve a bit of money to go show another community how to do that, and then just see if you can make it sustainable and sort of like have it catch fire and take off in another part of the country.
Have using fire catch fire. I really like that. I would have had no idea what you were talking about, in regards to fire, except Jean Ross taught me because she was developing, this app primary record so that people can keep their, medical record, even if
Right,
they go to 20 different places with different EHR systems, they can all talk to
right.
each other,
Yeah.
which she shared was, the legal requirement. Um, but let me go back to, when you were talking about, like, health departments and the CDC,
Yeah.
because I believe Obamacare indicated or every state should have an electronic health record in their, um, health department. Is that correct? And is that what we have now?
In their health department?
Like, yeah, for the public health department?
Well, I mean, there are a number of things that came out of, I'm not familiar with that, but when you think about, the old meaningful use and certified, providers they need to use certified health IT products in order to qualify for certain incentive payments. So that may be, what you're thinking about there, and that's something that we've worked on over time. My business unit inside of PointClickCare is very involved in building testing tools and excuse me, and things like that for certified products to use to make sure they're complying with the standards. Excuse me.
You get a drink. I can
Mhm. Yeah. Um,
So, what are some of the administrative processes that you would really like to see standardized across healthcare, like that have been proven that you just wish you could roll out everywhere?
yeah, definitely. Excuse me. The clinical documentation. I think some of the low hanging fruit that AI it will be particularly helpful with is when you're thinking about clinical alerts, clinical documentation, billing processing, creating documents for the public, data analytics, all those types of things are I think, relatively low hanging fruit for especially the administrative components of that are something that AI is really well suited for. And you can use there's so much burden on providers and doctors and nurses today to do all of this government reporting and fill out all the paperwork, et cetera. And AI is really perfectly suited to help them with that, with all the robotic processing, automation, et cetera. And I think just taking away some of those administrative tasks. They say something like 30 cents on every healthcare dollar is spent on administrative tasks.
Mhm.
And, another fact is like, on an average healthcare facility has 300 forms to fill out,
That sounds real.
yeah, I'm sure,
Ugh.
and so I think, getting rid of some of that and figuring out a way to automate that would really be helpful to get doctors and nurses back to their patients where they want to be and prevent some of the burnout problems we have today.
Yeah. So, what would you say is your passion project right now with your work?
Yeah, well, it's the new we have the up contract with ASTP right now to help them automate their administrative tasks.
Hmm.
So lo and behold, we are ourselves using it, and they have three main use cases that they're focused on. They have some very they're using it for data analytics. They're using it for content creation, and they're using it for public inquiry response systems.
Hmm.
And it's super helpful to see, I think, the uh, ASTP modernize their systems in a way to help them become more responsive to the public.
So, are
Mhm.
you talking about the response inquiry like we just did a response to a request for information
Mhm.
for the Centers for Medicare and Medicaid um,
Right.
on tools that would be helpful in healthcare? Was that you guys?
No, this was this is their they're using it for there's some regulatory requirements for developers,
Okay.
health IT developers to submit a real world test plan and results of that test plan to ONC or ASTP every year. I will probably always call them ONC. I can't get the name straight in my head. They just rebranded themselves.
Yeah.
But anyway, the and the way it works today is the information and the results of their test plans come in these huge reports that are sometimes they're 50 pages long, sometimes they're 200 pages long.
Right.
And so the staff there need to go through them and pull out the answers to in a standardized way to the questions. So we're using natural language processing. It's reading, AI is reading the documents, pulling out the answers in a standardized fashion, saving them all kinds of time. And then another one when they're doing content creation. So ASTP as a government agency or organization needs to respond to the public, create fact sheets, interpret regulation in an easy way. And so they're using AI to do what we're all doing. You're using AI to create content, and they do it in compliance with their style guide. So they kind of do it in a way that it looks the same across all their documents. And probably the most interesting um, piece of what we're doing for them right now is really taking advantage of their public inquiry system. So they get thousands of requests and questions that come into their organization every year, and we it comes in through a Jira system. It's a curated database, so it has the question and also the answer that's gone all the way through a decision and leadership on what the standard answer is for that question. And so we're pointing AI at that database as a curated database. And, and as new questions are coming in, we're able to look at the question, see who answered it last time, possibly route it to the last person that answered the question, and suggest the answer that was the approved answer from last time. So you can see like all these things are coming together
Yeah.
where, really trying not to reinvent the wheel and help them become more responsive to the public.
Yeah. And smooth out the workflow.
Yeah.
Yeah. That sounds really exciting. And then would Audacious Inquiry also be the humans that would be involved to make sure that they're not hallucinating their answers
Yeah.
or coming up with nonsensical results from these,
Yeah.
I don't know, billions of pages that they're reading through?
Right. Right. Yeah.
How are you double checking that much information?
Yeah. I mean, there are special agents that can be used to check for, special other tools that can be used to double check the answers to make sure that
AI agents are double checking the general AI.
well, everything we do, there's a human in the middle. So we do a couple of different things to look for hallucinations, and this is an evolving model where the information is live. So we're tapping into live information. We provide a rating system, so when the user gets the answer, they know the sources of the information, so they know how to they know where the information is coming from. But then we give them sort of a thumbs up, thumbs down. How good was this answer? And that helps to tune the AI model over time.
That is so exciting.
Yeah.
So, are you going to be speaking at any of the upcoming AI healthcare conferences this year?
At the moment, no, but
Would you want to, or does that sound like a nightmare scenario?
no, no, I love to talk about this stuff. Yeah, no, it's really it's been a lot of fun. It's been a lot of fun so far to work on this project and with a great team around me, and I think we have a lot to share. So it would be fun to share that.
Definitely. So, well, I really appreciate your time and jumping on here. And it's really great to meet the people who are behind the scenes working
Yeah,
on all this machinery. And if you've enjoyed this episode of the Nurse Rosa's Insights podcast, make sure you like and subscribe wherever you're listening or watching. Now, Greg, if someone has questions about Audacious Inquiry,
yeah,
where can they inquire?
yeah. Well, our domain name is ainq.com. They
Okay.
can also find us linked on the pointclickcare.com website as well. Um,
And I'll have both of those in the show notes for
yeah,
everybody.
okay.
Awesome. And then if someone wants to invite you to come speak, where can would you like them to reach you on LinkedIn?
LinkedIn is great. It's probably the best place to find me.
Fantastic. Well, thank you again for joining me. And for our listeners, if you know of another healthcare stakeholder who has an exciting answer to the $1 billion question of how to fix healthcare, then please share this podcast with them or let me know about them. And I'd love to meet them because we want to amplify solutions because anybody can complain, but we want to focus on how we can make things better. So I'll see you in the next episode.